Hey everyone, how are we going? Just going to start in a few moments, just a little board, but we are starting today for Christie's 35-week pregnancy scan. Now, don't be scared of my hair. It's something new, and we're just playing around and something different. I don't know. Anyway, so I'm just talking with Christie now. We're just waiting for her to get here. I'll just tell her that. Okay. Very exciting, big time. We've all been waiting for this for so long. Okay, she's here. Great. So that is perfect. Okay, so Christie's 35-week scan. We've come such a long way. Right from the beginning, I've been chatting with her before she was reborn pregnant to the pregnancy test, 8-week and 18-week scan. And now we're almost at the end, at the finish line. So today's 35-week scan, basically we're going to see, I'm going to see the baby's size, how we're going with the size. I'm going to determine how its head is situated, like the position the baby is, and just checking everything and make sure I've got it all up to date. Yep, so baby, that's the main thing. The size of the baby, the weight, the length, the position baby's in, checking all the fluid, making sure everything is going well. I think Christie might have said something else to me again. Okay, sorry, just checking this. Oh, she said she loves her hair. I'm not quite so sure about it, but it's only just happened, so I might get used to it. We'll see. Anyway, so also Christie has to get some tests today. We've got our usual, the blood pressure, the blood test, and while we're at it, could you check the pulse, put the pulse on? We'll check that. Check her heart rate, make sure everything is healthy and good to go. So we'll just put her pulse monitor on there. And I have already been working with Christie and talking with her over the last hour, and we have done one test on her, which we thought was more private. I had to do an internal on her, and I did that before the scan to make sure, well, it's obviously a private moment. So I will give you the results of that in a minute, Christie. So we're going all right with that. I'll just check myself and see how we're going. Your heart's racing a little bit there. You're a bit nervous. I think she might be. Okay, but it's good. And I haven't even mentioned, oh, hi Melissa. Melissa just said she loves my hair too. Wow, might be a new style for me. Anyway, I haven't even mentioned this belly. Look how big Christie has gotten, virtual Christie has gotten. We are doing so well. I just can't believe how big you are. She came in and I thought, my God, I'm going to fall off the table myself in a minute. So we're all going well there. Let's do the next one, please. Just keep that going for a minute. If you can get the blood pressure, we'll get this happening. Now, Christie and I were talking before about her labour, or what they call it is a pregnancy. Sorry, what is the word? I've totally lost it. But the labour note, like what your pregnancy plan. Sorry, I finally got it. Pregnancy plan. We were talking about her pregnancy plan and what she wants to happen out of this pregnancy. You might know of women, they've got different plans. Some people want to have a home birth. Some people want to have a water birth. Some people definitely want to be in hospital. Everyone has different wishes. And so, yep, you can take the pulse monitor off. Just let me feel it. Yep, that's good. You can take that off and put that on. So some people want a lot of drugs, some people want none. So it's a pregnancy plan, and each mother has a different plan. It doesn't always go to plan, but from me as an obstetrician, I need to know what she expects, what she's hoping for, so I can try to help make that happen. Okay, so this part just goes around here to the front. Turn your arm there, and this goes here like that. And yeah, that. Just relax and you can set that going. It's good to have helpers. Hopefully she is not going to blow up the mummy's arm. But all's going well there. It's getting bigger. Okay, so just relax. Just making sure it doesn't blow her arm off. Okay, so anyway, we've been talking about things like contractions and everything. And so basically, for other people that don't know, the contractions are literally a slow process to squeeze out your baby, to squeeze the baby out. And that's via uterine muscular waves of motion, just seeing how that's going, and to push the baby down into the uterus of the canal. That is okay. Can you go around and just make sure that plug is in that screen, because it's just gone dull on me and I would hate it to black out for some reason. Just the plug, just turn it a little. Yep, that's it. Yep, now leave it and walk away. Yep, no, yep, what? Walk away. Go back, Nurse Tiana. Okay, yes, so if you got that part about the contractions. And anyway, the important part of the process is your mental and emotional acceptance of pain. That pain is good in this sort of situation, rather than being frightened, of the thought and thinking it has to be avoided. It is something that's going to come, but we can help you along with different medication and drugs that make it much more pleasant to go through. But if you know, it's always different for everyone. I had 3 different births, totally different. One, I had full intervention of all drugs. The other one, I had a C-section. And the last one, no drugs at all. So 3 totally different ones. And I have to say the no drugs at all was my absolute favorite birth, if people can say they have a favorite birth. So if anyone else wants to ask me about that, you can let me know. But that just shows that everyone has different births all the time, and they're nothing to be feared about. Okay, so let's get on to this blood test because I'm chatting too much. So can I have the gloves, mask first up, please? And Christie has said something else to me, so I'm just going to check that. Yes, please. Nurse Tiana needs gloves. Ah, and Christie loves her virtual belly. You can give it a rub if you like. So we'll just get on with this. But next, yes, I know, Christie, I know you hate needles. And I'm sorry about this. But if you're just looking the other way when I say it's time, you'll be fine. It's only a little tiny little sting. Okay, so let's get this happening. It is a little bit hot in here because the air conditioning has gone down in this hospital. How can we survive in this situation? So we're just, Tiana's having problems getting her gloves on, which is very unusual because they're really easy. Okay, so I will get the tourniquet and you can get the needle syringe ready, please. Now, last time I did this, I plugged it wrong and it's still stuck in that position. Here we go. Okay, just put your arm up for a minute and don't drop it down, okay? I need to keep everything nice and relaxed. Okay, that's better. Okay, so clench your fist and just relax your arm there. Now, the pink one for today, please. All going well. Okay, so Christie, it's time to look away. Right, here we go. And Nurse Tiana, if you could just undo the tourniquet, just press the button, it should unclip properly this time. Yep, that's great. That just helps the blood to flow a little bit. Okay, so that's great. If you can put that away, put the needle tip in the Sharpie's bin and put the other part to send away to pathology. Okay, so we're doing really well. Next on the list, what would it be? Just take that tourniquet away. I think I pinched you a bit there. You all right? So she's all good. Okay, so next up. So mother's health, we need to talk about a bit about mother's health. So you would have been having some mood swings, possible mood swings. Not everyone gets them. General, can you take that for me? A general aching body, especially in the lower back, and it may be really hard to sleep. So you've been going through all of them, bit of toss and turning at night. That's quite normal, and don't worry about that. It'll be soon a little bit of different tossing and turning at night. So anyway, at this stage, I could recommend a full body massage to relax those aching feelings. Drink lots of water and eat plenty of fresh fruit and raw green leafy vegetables as well, and they will help you not to get the constipation, because constipation in late in pregnancy is very important. Well, it's not important, excuse me. It's very common. Thank you very much. Very common, and we don't want too much of that, because that's when you get hemorrhoids and they're not nice. Well, yeah, you want to get rid of them. So I'm just going to see what everyone's saying to me. Christie, she said, oh my God, yucky. So I'm pretty sure that would be about the blood test, I think. Okay, so now we will do the ultrasound. So I'll just get this going. Actually, I might need to get a set of gloves off you, if you can get a new set of gloves for me. And let's have a look at this belly. Ooh, okay, so I'm just gonna feel where baby is. So over here at the moment, we've got baby's bottom, and his legs go down here. Yep, I can feel a foot there. So that's his back and his neck and head. And it's safe to say that baby is really low, really low. So his head is down, which is very important and very good. That's what we wanted to hear. We don't want to hear it up the other way. Although at this stage, they can still turn a lot. So it's not too bad if they're bum down at this stage, they'll still turn. Okay, so if you can get the screen set up for me and then bring it over when it's ready. So as you remember, I have got the wireless ultrasound. Christy has just said something else. And she said, oh my God, I'm too excited. Yep, it's very exciting, very exciting. Okay, so we'll just bring the ultrasound over here, and hopefully everyone will be able to see. Okay, should be right. Okay, so let's start this off, and we will do the heartbeat as well soon. So yeah, if you could just stay over there, call over there, and when I have to hand it to you. Well, Nurse Tiana has gone, so I'll just put the ultrasound gel on. Whoops, I went a little bit over the top there, but that's all right. Makes it slippery. I can't say anything to you at the moment, Christy, because my hands are all yuck. So let's get this thing moving. Turn it on. Oh, there we go. Oh, I hope you can see baby. Oh, there's not much room in there. Can I get you to hold that so I can talk? So here we've got baby's head down in there. You can see baby's hands. Yep, baby's hands are up here. Sorry if my hands are in the way. So yeah, we've got baby's face on screen there. Oh, really low. Okay. Might take this off. Doesn't touch the screen. Okay, so I'm hoping you can see that all right. A little bit of movement here. I'll turn that to 3D in a second. That's baby's head again there. It's facing us at the moment, actually. Yep, good. Put it in. Right, great. So there's the 3D image. Can we make that bigger? Yep, thank you. Keep going. Okay, so you can see the baby's side profile there. We've got the side of the nose and the mouth, and the hands are down here. And there's the 2D screen versus the 3D. I know it might be a little bit hard for you to see. I'll pull it up. Yeah, you can see baby there. Nice and easy. You can see I'm turning it around there, and it's got its hands up to its mouth at the moment. Everything's looking good. Now let me just measure the baby. So excuse me if you're just watching at the moment, and I will do some measurements. Okay, so okay, I know it's hard to see. Yep, that's what I want. Okay. Nurse Kiana, can you get me that pen over there, please? Okay, so I'm just measuring the whole length of the baby. You can still see it there. So that has come up to some calculations. I know it does a lot for me, but okay, so that's good. I'll tell you afterwards, actually. And I'm just going to check the general weight of what I think Bubby is. Okay, good. Good. Okay, just hold that for, I'll just put that down for a minute there. And I'll just do this measurement. Sorry for 1 second. Okay, that's good. Okay, so I'll do the heartbeat now. My hand's all sticky and yuck. It's pretty normal though. Okay, so if Diana, you can just turn that machine on, get the heartbeat going. I'll just try to start this up again. Okay, I can see the heart will be on screen. Yep. Okay, yep. Okay, you can see the heart there. It's a little bit harder at this stage to get the heart because although the baby big, oh, stop moving, it's moving. You can hear the heart though. That's fine. Just turn the heart monitor off. Just want to do that last measurement. Okay. Okay, so I'll just take that away. Thank you very much. Sorry for the extra long one, but we had to make sure, make sure those go in the bin. So anyway, baby size, are you ready for this, Christy? I should see what she has said. Okay, so she said, oh, wow. So she must mean towards the baby. So before I keep going, I'm sure, Christy, that you'd really like to see your baby a little bit closer up. So I've organised to screen share the printout of, you did do the printout, didn't you? You just clicked the print, yep. Okay, she's done the printout, but I've got it on the screen here. So hopefully you'll still be able to hear me, but if you can't hear me, I'll be back in like 30 seconds after you've seen it. So let's have a look at baby. Okay, so there's baby. That's his side profile, as you can see, in the side of his arm, and you can see the ribs just under his arm, and obviously his little tiny hand. And that's what I print out and send off to Christy in her, hello, I'm back, in her 35-week pack. So let me see if she said something, which she did again. She's right on the ball today. Okay, she said, too cute, and she can't wait to hold him. So just confirming with you, Christy, that it is a him. It definitely is a little boy. Okay, so the size of him at the moment, he's approximately between 46, 48 centimeters. So obviously he's going to get bigger. Just seeing what she said again. Okay, she can't wait. Okay, and his weight at the moment is about 5 pounds 2 ounces. So that's quite normal, and that's quite. Oh, he didn't see the pic. I'm really sorry about that. I'll have to look at that. I'll have to try to attach it to the end or something if I can, but you'll definitely see it anyway, Christy. So anyway, for babies at most babies at this stage will have blue eyes, though the color may change within the first few weeks of the baby being born. So baby's still building up fat on the body in preparations to birth. Lungs are still developing, and the male babies, the testes have completely descended. So let's get a little bit more back onto this baby before I finish up. Just want to make sure I've gone over everything with you. Okay, yes, so I talked about Christie's labour or pregnancy plan, and Christie has been very, very easygoing and has said she absolutely doesn't care. She just wants this baby to be born nice and healthy. She doesn't care about any intervention she has, any drugs, any forceps. She does not care. So the big news anyway is Christie. Sorry, she just keeps talking to me and I need to talk to her, make sure she has any questions. Okay, just a love heart. Okay, so Christie, I can cover you up there. So in checking baby, like I said, its head is down and baby's head is actually engaged. So when the baby's head is engaged, it's more likely that a birth might start earlier, although in some cases they can still go to full term. But what makes it more real is when I did the internal before, you have already started dilating. So you're about 2 to 3 centimeters dilated. Once again, that can still go for weeks yet, but I have a high feeling of knowing how the baby's positioned, how you're feeling and everything, that this will be come a couple of weeks early. So I'm thinking a premature baby, but at the moment everything's healthy. He's a good size, he's a good weight, and there's 99% survival rate at this stage if he is born. We've got all the intervention, all the equipment here to help any baby born early. So that's really good news, and it's good news for everyone. Now, everyone, I'm not doing the pregnancies via live streaming. It's just too hard to do in this little cubicle room. So I wanted to do the video and then piece it together and everyone will see it. So please keep an eye out over the next two to 3 weeks. Just see what Christie has said. Okay, so she said she's so nervous now. Nothing to be nervous about. It's really, really exciting, and I'll be here to help you the whole way along. And she's talking a lot. She's very nervous, that means. But she's excited still, she said. Okay, so yes, very exciting. Thank you for everyone for joining me. As everyone knows, Christie was my first pregnancy package. So it's been such a long road, and we've got to 35 weeks now. Oh, and by the way, 35 weeks, you're not 35 weeks. The measuring showed up as 26 weeks. So you are further along than we actually thought. It's been a little bit up and down with your pregnancy. So you've only got within the next 4 weeks that you know you're due, but as you know, overdue, some babies can go 2 weeks overdue. So, but I don't think we'll get to 6 weeks. I'm thinking more 2 to 3 weeks at the moment. That's how it's looking. That's how baby's looking for sure. So let me do a quick shout out. Sorry, I always finish off and I go off like that. Christie, if you have any questions, you know you can ask me, and if anything is happening with you, please let me know. Also, I really need you to rest. So put your feet up. No more going to the pool and having more fireworks. That's out now. You can't do that anymore. I need you to put your feet up at home, because obviously the longer we can make this pregnancy go, the better. So preferably not a premature. It will be okay if that does happen. I just want to assure you of that. So I hope you're happy with everything. And I should also say Maddie is watching at the moment, and she has said she's so happy for her. So hi, Maddie. Maddie is getting her 8-week scan on Wednesday, I think it is. Yeah, Wednesday, Brisbane time at, what time did I say it was, girls? I think it was 8:30 at night. But anyway, if you go into my channel and look at live events, you will see Wednesday's one. And also tomorrow at 10 a.m. in the morning, we have Elaine's pregnancy test. So that's really exciting too. Other things you may not have seen, which I haven't announced yet, is Christie's saying, yeah, is that we have Debbie and Eva coming up for their 35-week scan. So that probably won't happen next weekend, but I'm guessing it's going to happen next Monday or Tuesday at this stage. I've just got to work around when my virtual mummy can help me. So sorry about that. Now, I'm not sure if I gave the shout out before, but I've got a shout out to Nana's Reborns. She often watches my videos and often comments, and I just wanted to say hi again. I think I've said hi to you before, but it's always nice when I see your name pop up, and I'm glad that you watch and enjoy all of our videos. So one last thing from Christie. Let's see if she has anything to say. She is so happy. So I'll just say that out again. Anyone want to say anything to me or Christie, if you've got one last thing to say before I go, say it now or forever hold your peace. So anyway, exciting news. The next time you'll hear about Christie is when you see the birth of her beautiful son, which will be very exciting, and she can't wait to have him home. So it's exciting here for everyone. So I hope everyone has really enjoyed watching today's 35-week scan. Sorry, it was a bit quiet in some periods, but we have to do these tests and make sure that everything is going all right with pregnancy. They're very important. If I don't keep an eye on it, then I can't know how we're all going. So, Christie, hopefully we're going to go for a full natural birth, and your baby will be coming very soon, and I will give you plenty of drugs if you need them. So that you can count on me. I'll help you. Okay, so nope, she has nothing to say, I'm pretty sure. So anyway, thank you everyone for watching tomorrow. Please be sure to come back tomorrow morning. Christie has said something, which is it 10 a.m. tomorrow morning. Just if you go to my live streaming, it'll have a countdown there. We'll actually tell you how many hours until it actually is, so you will know what time it is in your state or country. Okay, so Christie said that I have done well, so thank you very much. And thank you everyone again for watching, and we'll see you tomorrow morning, hopefully. Bye, guys.